Thanks, Sally. Today is World Suicide Prevention Day, and coming up, we're going to take a look at how you can easily identify the signs to seek help for your loved ones. And it started years ago as a day meant to raise awareness in an effort to prevent suicide. So today, September 10th, is World Suicide Prevention Day. Reports show suicide rates here in the United States have gone up 25% in the last 20 years. So what is going on, and more importantly, how do we bring this number down? We have Dr. Jason Castillo, the medical director of Ignite Teen Treatment, here to help us better understand this tragic epidemic. Dr. Castillo, thanks for joining us today.
Thank you for having me.
This number, it's just going higher and higher. More than 45,000 Americans died of suicide last year. Why do you feel that this number is so high?
I'm very glad that you're bringing up this very important topic for us. Over the last several decades, we've actually seen a steady increase in the number of suicides in America. There's no one specific cause for this. But there is actually some hope in that we're understanding how, hopefully, to prevent some of these tragedies. I think I can point to data from the Veterans Administration, the VA. They're taking active steps to identify people that are most at risk of having suicides that are either active duty or veteran populations. They're identifying risk factors and being able to give the resources to those veterans that need them more quickly. And I'm very interested in seeing the outcome, the success of that kind of program.
That's really important to have programs like that. And I've also seen that the number of kids, young kids committing suicide is going up. And they say that a lot of times when a celebrity commits suicide, that they tend to see the numbers go up in that. Is that something to be concerned about as a parent when you're watching these things happen? And how do you talk to your kid about that?
This is a very important topic. The age group that has had the most increase over the last several decades of suicides, unfortunately, is young people. So that is something that we take quite seriously, and hopefully we can start teaching these mental health first aid techniques and being able to recognize the symptoms of depression and when stress is burning out our children sooner rather than later. I think that is something that's quite important.
What are some of the signs that we can look for? If you're concerned about someone taking their life, what should we be aware of and look out for?
So first and foremost, recognizing the signs of depression, arming ourselves with education about what depression looks like. The statements that we hear from our loved ones of feeling empty, hollow, hopeless. Hopelessness is the big number one kind of factor that we're looking for in somebody who's attempting suicide. When we're in that hopeless state, we don't see that things might get better. We are trapped in the pain of today is only going to get worse tomorrow. And that can be something that leads folks to end their lives. So recognizing when the mood symptoms come out, and also you can recognize when your loved one's not acting the same way that they were. Their sleep is off, their appetite is off, they're not socializing with people they usually like talking to.
And that's something you really need to be aware of, because sometimes you chalk it up to them, oh, maybe they're having a bad week, maybe they're having a bad day, but you should always assume that the worst could happen and be there for them.
Yeah, you want to be a positive source of support, a non-judgmental source of support.
That's important.
Yeah, you want to be somebody that person can talk to without fear, without that you're going to judge them for their thoughts and their feelings, without you thinking they're going to be weak. We don't want to tell them, just go ahead and cheer up.
Yeah,
that's one of the worst things. That's one of the worst things you can tell somebody who's severely depressed. You want to be there as a support, and you want to play your role. Am I somebody's brother? Am I somebody's cousin? That's a very important role for somebody to play. You're not necessarily their therapist or their doctor, and you don't want to play that role.
That's true. There's professionals that can do that. And if you think you need help or you know someone who does, make sure you contact Ignite Teen Treatment at igniteteentreatment.com. Thank you so much, Doctor. We appreciate it. Coming up, it's over to you, Courtney.